Hello everyone, my name is Dante Puntiel, and I'm a Latino man from Perth Amboy, New Jersey, and I'm currently a medical student at Temple University Lewis Katz School of Medicine, and together we can elevate med. Growing up in Perth Amboy, a predominantly Hispanic community, I witnessed firsthand in my friends, family, and neighbors how social determinants of health shape patient outcomes. As a first-generation student, I saw medicine as more than just a profession. It's a means to advocate for underserved communities, for the patients that far too often fall through the cracks. One of the most defining moments of my life was watching my grandfather navigate the healthcare system, only to continuously be failed by it. After immigrating from the Dominican Republic, he struggled to establish care with a primary physician. Unfamiliar with the system, uninsured for much of his life, and unable to take time off of work for doctor's visits, he resorted to using the emergency department for his medical needs. Without consistent care, his chronic conditions, hypertension, diabetes, and heart disease, worsened unchecked. The cycle continued until one day it was too late. He arrived to the ED in septic shock, was rushed to the ICU, and despite aggressive treatment, he ultimately passed away. His death wasn't just a result of illness. It was the result of systemic barriers that left him without access to preventative care that should have saved his life. My grandfather's story was not unique. I saw similar struggles play out across my community. People delaying care because they couldn't take time off of work, struggling to afford medications, or feeling lost in a system that wasn't built with them in mind. I realized that access to quality healthcare isn't just about treatment. It's about advocacy, communication, and ensuring that every patient feels empowered in their own care. Currently, my passion lies in emergency medicine. I find that I thrive in high-intensity environments that require quick thinking, teamwork, and resourcefulness, qualities that directly impact patient survival. Emergency medicine also allows me to work at the intersection of medicine and social justice, treating vulnerable populations who may not have access to routine care. Prior to medical school, I was an EMT and worked in the emergency department, where I saw my grandfather's story unfold over and over again. Time and time again, I treated patients who, like him, had no access to primary care and relied on the ED as their only source of medical attention. I transported patients who had delayed seeking care due to financial concerns, language barriers, or fear of missing work, only to arrive at the hospital in critical condition. In the ED, I saw firsthand the consequences of these systemic failures: undiagnosed chronic illnesses, preventable complications, and difficult end-of-life conversations that might have been avoided with early intervention. My experiences have given me a deep understanding of how background and lived experience shape the kind of care we provide. Beyond patient care, I believe one of the most impactful ways to improve medicine is by ensuring that those who are underrepresented and come from disadvantaged backgrounds have a seat at the table. Diversity in medicine isn't just about numbers. It's about the perspectives we bring that help us better serve patients and educate our peers. Through my leadership roles in the Latino Medical Student Association and the Student Diversity Council, I've worked to advocate for underrepresented students and create initiatives focused on recruitment, mentorship, and retention. I see leadership as a means of empowerment, not just for my peers, but for the next generation of physicians who will continue pushing medicine forward. My goal is to use my skills and experience to foster an environment where aspiring doctors from all backgrounds have the support and resources to succeed, knowing that their voices are needed to shape a more equitable healthcare system. And I believe that is the best segue into discussing what I hope to get out of joining the ElevateMeD community. Mentorship. Mentorship is one of the most critical factors in the success of underrepresented and disadvantaged students, yet it's something many of us struggle to access. Without strong mentorship, navigating the path to and through medicine can feel isolating. I want to be a part of ElevateMeD because I know that having guidance and a supportive network can make all the difference. For me, this opportunity isn't just about receiving mentorship. It's about learning how to be a better mentor for those coming after me. I want to continue the cycle of lifting others up, ensuring that future underrepresented students not only enter medicine, but also thrive in it. Lastly, to the donors and supporters of ElevateMeD, thank you. Your generosity extends far beyond financial assistance. It creates opportunities for students like me to thrive, to lead, and to serve our communities with excellence. Your investment in our futures is an investment in the future of medicine itself. I am incredibly grateful for the chance to be a part of this mission, and I promise to pay it forward by continuing to advocate, mentor, and inspire others in the field. Your belief in us fuels our drive to make a difference.